Knowledge is power. Did you know? The image you shared highlights how localized pain can sometimes be a referred signal for a much deeper systemic health issue. While these symptoms don't always mean the worst-case scenario, understanding the connections can help you know when to seek medical advice. Here is a detailed breakdown of the points mentioned in the image. 1. Chest pain, possible heart issue. The fact. The most common sign of a heart attack or angina is chest discomfort. It may feel like pressure, squeezing, fullness, or pain in the center of the chest. Why it happens? When the heart muscle doesn't get enough oxygen-rich blood, it sends pain signals. This can also radiate to the arms, neck, or jaw. 2. Sudden headache, stroke warning. The fact. A sudden thunderclap headache, the worst headache of your life, can be a sign of a hemorrhagic stroke or an aneurysm. Why it happens? This occurs when a blood vessel in the brain bursts or is severely blocked, causing rapid pressure changes in the skull. 3. Calf pain, blood clot risk. The fact. Deep vein thrombosis, DVT, often manifests as persistent pain, swelling, and redness in the calf. Why it happens? A clot forms in a deep vein. The danger is a pulmonary embolism, where the clot breaks loose and travels to the lungs, which is a life-threatening emergency. 4. Toothache, infection warning. The fact. A persistent toothache is often more than a cavity. It can indicate an abscess, a pocket of pus caused by a bacterial infection. Why it happens? If left untreated, the infection can spread to the jawbone, surrounding tissues, or even the bloodstream, sepsis. 5. Joint pain could be arthritis. The fact. Chronic stiffness or pain in the joints, knees, hands, hips, is a hallmark of arthritis, which comes in over 100 different types. Why it happens? It is caused by the breakdown of cartilage, osteoarthritis, or an overactive immune system attacking the joints, rheumatoid arthritis. 6. Back pain, possible kidney problem. The fact. Pain in the flank area, the sides of your mid to lower back, can be a sign of kidney stones or a kidney infection. Why it happens? Unlike muscle strain, kidney pain is usually deep, constant, and may be accompanied by fever or urinary changes. 7. Ear pain, infection sign. The fact. Earaches are frequently caused by bacteria or viruses in the middle ear. Why it happens? Fluid buildup behind the eardrum creates pressure and pain. In adults, persistent ear pain can sometimes signal issues with the jaw, TMJ, or even the throat. 8. Foot pain, diabetes warning. The fact. Burning, tingling, or numbness in the feet, peripheral neuropathy, is a very common complication of high blood sugar. Why it happens? Over time, high glucose levels damage the tiny blood vessels that supply the nerves in your extremities. 9. Stomach cramp, ulcer sign. The fact. Sharp or burning pain in the upper abdomen, especially when the stomach is empty, can indicate a peptic ulcer. Why it happens? This occurs when stomach acid eats away at the protective lining of the digestive tract, often due to H. pylori bacteria or long-term NSAID use, like aspirin. 10. Burning legs, nerve issue. The fact. A burning sensation is often neurological rather than muscular. This could be due to sciatica or compressed nerves in the spine. Why it happens? When a nerve is pinched or damaged, it sends misfired signals to the brain that feel like heat or electricity. 11. Shoulder pain, possible lung problem. The fact. This is a classic example of referred pain. A tumor in the top of the lung, Pancoast tumor, can press on nerves that lead to the shoulder. Why it happens? The brain gets confused by the nerve pathways and interprets the lung irritation as pain in the shoulder blade or joint. 12. Stiff neck, meningitis warning. The fact. A stiff neck combined with a high fever and headache is a red flag for meningitis. Inflammation of the membranes covering the brain and spinal cord. Why it happens? The inflammation makes any movement of the spine extremely painful and rigid. This requires immediate emergency medical attention. Important note, this information is for educational purposes. If you are experiencing any of these symptoms, especially chest pain or a sudden severe headache, please consult a healthcare professional immediately.